Hi, good afternoon. We have a lot of people joining in right now. So if you'll just give us a couple minutes, we're going to get started right at 11. So we might wait a few more minutes and then get going. Thanks everyone for joining so far. We're gonna wait to start.
Good morning.
Good morning.
Good morning.
Morning.
This is Elizabeth Harper. Thanks so much for joining today. We're going to give people a few more minutes to call in.
Okay.
Elizabeth, Joel Lee here. Am I correct that this is voice only?
No, there is so for everyone on the line, there is a webinar feature. There should be a link in the calendar invite. So if you click on that, you should be able to join the webinar feature. So there's a call-in and webinar.
Yeah, it's not. Is there anything displayed, or is it just a blank screen right now?
Well, right now it's a PowerPoint slide, so it shows like intro information. It says PHWin's Data Users Webinar. That's what should be on your.
I'm just seeing a gray screen at this point.
Okay.
This is Gulzar Shah, and actually I can see the screen, PHWin's data users and the names of presenters.
Okay, well let me try a different browser then.
Okay, thank you. Let me know.
Great, thank you.
Hi Elizabeth, this is Dina.
Hi, how are you?
Good, how are you? I'm also able to see the webinar as well.
Okay, great.
Okay. Yeah, it's Firefox wasn't letting me in. It looks like I can get into it in Chrome.
Okay, great. So it's just after 11. We're going to go ahead and get started, everyone. We have about 20 participants, so I think we'll have a few more joining us. But I can go ahead and get started with introductions. I just want to thank you all on ASTHO's behalf for joining us today. We are really excited for all these projects and your interest in the PHWin's data set. We're thrilled to be able to share it with you and to learn from your research. Other speakers on the phone are JP Leiter from the Beaumont Foundation and Vicki Pinu from NORC. So JP, Vicki, if you could introduce yourself, we can go ahead and get started. I think we're
Sure. And just a reminder to folks on the call, if you could mute your line while if you're not asking questions, that'd be great. We have a little bit of background noise right now. So as Elizabeth said, I'm JP Leiter.
I'm so sorry. Okay.
I think we got some background noise. Folks could mute their line. My name is JP Leiter. I do research evaluation work for the Beaumont Foundation. For those of you who don't know us, the foundation is a public health systems funder working in three particular areas: public health workforce, public health data and information, and public health infrastructure. And so we've been very happy working with ASTHO for a couple of years now, building up to the creation and fielding of PHWin's, which Elizabeth will talk to you about. For us, it's really important both to get the research out to the field, but also to connect directly with practitioners at state and local health departments to help inform their training needs and provide some of that to them. So any questions later on about the foundation, happy to answer them, and how we're going to use this in the future. So Vicki.
Hi everyone. Yes, I'm Vicki Pino, and I work for NORC at the University of Chicago. And our organization is a nonprofit research organization where we support social science research and issues. And my background is survey statistics, a survey statistician here, and been fortunate enough to work with ASTHO and Beaumont on this important pH wins project. So we helped with the sample design, sample weighting primarily.
Thanks, JP and Vicki. So just to briefly go over today's agenda, we're going to start with a description of the study, and then really Vicki and JP are going to take over, talk about the data cleaning, the generation of the variables, also analysis, and some guidelines there. We're going to have some questions after that related to the regional level data set. And then for anyone who isn't interested in the local data set, they can hop off the phone. We'll have an explanation of the local data set and what the capabilities and strengths and weaknesses of that are. And then we'll have some more questions. So the speakers have scheduled to be available until 12:30, so if we need to go over, we can. I also want to make sure that everyone is aware of the chat feature. So if you do have a question, I would please ask you to hold that until the question section of the webinar. But please feel free to type in those questions as you have them, and we can address them. So if there are no questions right now, I'll go ahead and get started. So there were two main phases of pH wins. In phase one, we engaged individuals from national public health leadership groups as well as national partner organizations in a strategic visioning process. This process included document review, key informant interviews, and small group work with ASTHO affiliates, peer networks, and partners. The intent was to identify actionable workforce priorities, needs, and opportunities. Partnerships in the strategic visioning process met in April of 2013 to reach consensus on the top priorities for workforce development. A total of 26 workforce development issues were identified, and the group ultimately prioritized the following 6 on your screen. Building on the work of the strategic visioning process and agreed upon priorities, the Beaumont and ASTHO convened a technical expert panel to help guide sampling strategies, survey development, and administration. The technical expert panel developed the goal of pH wins, which is to collect perspectives from the field on workforce issues, to validate responses from leaders on workforce development priorities, and to collect data to monitor over time. From that, 3 aims were created that you can see on your screen, and those were to inform future workforce development initiatives, to establish a baseline of key workforce development metrics, and to explore workforce attitudes, morale, and climate. Moving on to survey development, pH wins was developed with 3 sample frames in mind. The first would be a nationally representative sample of central office employees and state health agencies. The underlying assumption was that regardless of governance classification, whether the state had decentralized or centralized local health departments, every state health agency had a central office. The second frame would be of employees of members of the Big City Health Coalition. That's a membership group of the largest local health departments in the country. The third would be a pilot frame of local health department employees, and it was decided that it would be too difficult to get a nationally representative sample of local health department employees in the first fielding of pH wins. The 2 guiding principles were laid out in the early stages of survey development. The first was that the survey needed to be as short as possible to minimize the burden on practitioners and respondents. Technical expert panel identified 4 major domains of interest for pH wins as listed on your screen. Those are training needs, workplace environment and job satisfaction, perception of national trends, and demographics. The second principle was that the instrument should utilize previously used items and questions wherever possible, and you can see a list of those instruments that we use to adapt the questions for pH wins. The final part of survey development was to conduct cognitive interviews and pre-testing. Cognitive interviews were to establish how public health practitioners would interpret those survey questions, and then we conducted rounds of pre-testing to identify any problem areas or places where we could clarify questions. So recruitment and fielding for this project, to recruit states to participate in PHWINS, we asked the state health agencies to appoint a workforce champion to serve as our point of contact within the agency to assist in communications and promotional efforts. We also offered 3 levels of participation for every state that we invited. There was a nationally representative sample. This was the baseline option that allowed us to contact the least number of staff per department. 10 states participated in this option. There was also an option to increase the sample so that we could provide them with a state-level report and to account for any response rate issues that we might have, and 3 states participated in that report, or in that method. The final level of participation was a census option in which 24 states participated. So in terms of fielding the survey, it was fielded from September to December of 2014. Approximately 54,000 invitations were sent across all 3 of those frames. Approximately 5 reminders were sent out, spacing 2 to 3 weeks. During the time that the survey was in the field, we did real-time monitoring and checked the number of declines, participant declines, email bounce backs, technical difficulties, and state versus local responses. So now I'm going to turn it over for the data and analysis overview.
Hi, everyone. And just, Elizabeth, one slight modification to the last slide. It's important to note that in the state fielding of WINS, we stratified it regionally. So that means kind of practically, as Elizabeth said, we ended up drawing a number of the samples from each of the states. But just so everybody knows, and this is in the documentation too, fundamentally you can get regional and national estimates from the state level frame, not necessarily, from the state frame, but not state-specific estimates in the public use file. So sorry about that slight clarification. It's also in writing in the guidance documentation we sent you. So with that, I'm happy to go to the next slide, Elizabeth. Okay, so this survey was conducted in Qualtrics, which does a pretty good job of keeping all of the data clean. There were some kind of significant display logic, skip logic, cleaning that we needed to do that you can see documented in the reports. But for folks who, oh, actually, I'm sorry, that's on the next slide. So why don't we hop on over to that? The skip logic you're going to see is either .a, so it's an extended missing in STATA and SAS. For those in SPSS, we put that value as -99. For variables that were seen but not answered, just a standard missing is going to apply. A number of variables were condensed for confidentiality reasons or for ease of access or use. Those are generally going to be, there's generally going to be an X or an XC as a suffix. You can see those in the code book, for instance. The one for race ethnicity, Q510, for role classification and job classifications. You can kind of see those are generated variables. We did this so that we can kind of protect, as I said, confidentiality, and just to make analysis a little bit easier, to really take an awfully large number of potential items and condense them into kind of more useful ones. Okay, so the final note for cleaning is that there are a number of open text answers, especially in job satisfaction and workplace environment. Most of you didn't request variables that relate to that, so they're not going to be a big deal for you. But just so you know, in the data sets you received, you're going to see that suffix there to kind of clearly indicate that this is a text or string response. If you have any questions about those later on, please feel free to ask them either in the chat or over the line. Next slide. Okay, so this is the structure of the code book. In the Excel file we sent you and yesterday, and is on the website as well, you're going to see a number of tabs at the bottom that relate to the 4 or 5 sections of PHWINS, and those would be workplace environment, priorities, trends, a number of demographics related questions, and then other generated variables which we put in really for your guys' ease of use. Like, for instance, which paired HHS region they're in, some of the weighting variables, governance classification, so that would be the centralized, decentralized, shared, mixed, et cetera, that ASTHO and NORC and Nature put together a few years ago, so you guys can look at that if you like. And then there's the population size of the state health agency, also from ASTHO. So as I mentioned, the basic structure of the codebook will have at the bottom the tabs for the different areas, and then when you look within the actual codebook itself, you're going to see that the variables are going to start typically with a Q, and then each of the sections will kind of go from there. Again, anything with an X or an XC is a generated variable. There are also a couple other generated variables in that tab that don't have XC and then but are just words like governance, for instance, or setting. Okay, and I think with that, the last thing that I want to mention for generated variables is Q525 and Q534, and I'm sorry for the slightly confusing nature of the naming. Q525 is a role classification. That comes from the Public Health Taxonomy project out of Michigan that folks from CDC and Michigan and others have worked on for a number of years. So this was the first time that I think these taxonomy classifications were used in WINS. Were used for the first time here in WINS. And there's a couple folks on the call who maybe later on will tell us a bit about some extra work that they're doing on these questions from the WINS data. An awful lot of responses went into the other or open text categories. So right now you're going to see that 525 and 534 do have values that you can use in your analyses, but what you should know is that they're being revised by this group that I've just mentioned, and so won't be finalized for a little while. So kind of keep that in mind as you're doing your analyses, and that'll be a pretty significant consideration in any, for instance, paper that's put out before they're finalized. Okay, so with that, I'm going to turn it over to Vicki for weights.
All right, our favorite topic, right? Sampling weights. So as Elizabeth and JP said, this survey was administered in several components, the main component being the state level or national frame, where we were ultimately looking for central office permanent employees as the base sample for the analysis. So the set of weights I'm talking about here on this slide, that we call them regional national weights, REG, NAT, WT. And basically these weights account for the differential sampling that was implemented across the states that participated in the study. So the sample weights, look at the stratification and the differential sampling by population size as well as by HH region size, with the goal of having these weights once used with the data of central office permanent employees across the states, that we are able to estimate at the national level as well as the HH paired region levels that are in this slide. And for whatever reason, my computer just went blank. So now I'm talking from my hard copy slide. Let's see, we had about 19,171 completed interviews across the 37 states, and about 10,000 of those ended up being central office employees. So all the central office permanent public health employees will have a positive regional national weight. So in addition to having the weight to use for the national and regional level estimation, in order to calculate standard errors that account for the complex design, we selected to use an approach called balanced repeated replication for variance estimation. And this approach is, a little bit more complex than you would normally just use with assuming a simple random sample of a survey sample. But the BRR accounts for, like I said, the complex design, the stratification, and differential selection across the states. So balanced repeated replication can be specified and used in SAS and R and STATA. And for this set of weights, the regional national weights, we actually calculated 40 sets of replicate weights, which are called REG_rep weight. And there are 40 of those. And those 40 are only needed for the variance estimation. They're not the ones that you use to estimate your outcomes from the survey. You still want to estimate your outcomes using the regional national weight. Okay, so the next slide. Don't want to bore anyone or get too complicated about what balanced repeated replications does, but just sort of a slight overview so you understand it's really a fairly straightforward approach, and it's very robust. It can be used to estimate the variance and standard error with basically any outcome you want to produce from the data, whether it be totals or proportions or regressions or medians. It's a very robust approach. So if you look at the formula on this slide for balanced repeated replications, we actually say the variance of theta hat, and theta hat is the survey outcome. So it might be the percent of central office staff that have heard nothing at all about fostering cultural equality in their agency, or it may be their job satisfaction. So theta is your survey outcome, and we want to calculate a variance and then the standard error for that estimate. So balanced repeated replications does this on its own. You don't have to use this formula. This is just for illustrative purposes. That 1 over H is the number of replicates that are being used. And in our case, for the national regional weight, we have 40 replicate sets of weights. And then we've just got a sum of differences, where the differences comes from taking the estimate from, say, replicate 1 minus the original estimate using our regional rep weight, regional national weight, and then we sum that to the second difference, which is taking replicate 2 minus the original weighted estimate, and then replicate 3, etc. So we do that for all 40. Take the square, the difference squared, and then that's summed up, and that gives us a variance estimate. And then the square root of that variance is the standard error for what you're trying to estimate from the survey data. And again, with proper coding, SAS, STATA, and R will calculate the variances and standard errors under the BRR approach. So we have just a couple of examples. I think the tables and the examples may be a little hard to read on the slide, but these same examples are included in the data user documentation that Elizabeth sent out with the invite and the other materials. So if you have trouble reading it on the slide, it is in that document, the exact same examples. So we first have a slide that gives code for estimating proportion and its standard error using SAS. And the main thing I want to point out to you, because obviously your calling for the data files will be different than what we have, but if you look in the middle on the left side under the SAS example, it says var method equal BRR. So we're basically specifying to use balanced repeated replication method for variance estimation. And then the original weight for calculating the estimate survey outcome is read underscore nat weight. And then the rep weights are read underscore rep weight 1 to 40. So in this case, it doesn't say 1 to 40, but SAS understands there's an array of rep weights that they're supposed to read and include to calculate the variances. So once you run that, then depending on what you specified for your output, we get, for this particular example, we're looking at how satisfied the employee is with their job, Q2 underscore 6 underscore 1. And you can see the outcomes are very dissatisfied, going to very satisfied. And then you have your N, which is the sample count for each of those outcomes, and then the mean or the proportion, which is calculated using the reg nat weight. So if we're very dissatisfied in the data set for the permanent central office employees, about 3.5% reported being very dissatisfied. And then the standard error of the mean, which is on the far right side for that first top table on the right, that standard error of the mean was calculated using the BRR variance estimation approach. So the standard error is basically 0.2% for the very dissatisfied outcome. And then the table below just gives you a little more information based on the confidence interval for the estimates as well as the coefficient of variation. So, instead of assuming simple random sampling and calculating the variance, we're assuming complex sampling, and our replicate weights get us the best standard error for our estimates. One more example, just briefly, we have on the next slide an estimate of a total and the standard error. Similarly, only this time we're providing some example code using STATA. And on the left side, you can see that the survey code, we indicate that the P weight to use for this data set is, again, the reg_nat weight. And then in the next line, we have the variance we want to produce using BRR. And the BRR weights are reg_rep weight to 1 to rep weight to 40. So again, the exact same approach. The official weight, and then the replicate, 40 replicate weight. And you see there on the right the output where it gives the number of observations that went into this, how many replicate sets of weights we had, which were 40, and then the outcome for Q26_1, again, which is the satisfaction question, where the first response, 1, is very dissatisfied. And so we get the estimated count across all the permanent central office employees of 1,480 central office employees reported being very dissatisfied. And again, this is an estimate at the national level. And then we have beside it the standard error calculated using BRR, the coefficient of variation beside it, and then the 1B and UB are the upper bound and the lower bound for the confidence interval. So in the documentation that was handed out, in addition to the proportion and the total, we have a simple logistic regression that is in that documentation, and we provide example code for SAS, STATA, and for R. So hopefully that will be the core information that you will need in order to calculate variances and standard errors from the data for using the regional national weight. So I think we can move on unless JP or Elizabeth think we need to cover anything else there.
Sounds good.
I don't think so. So right now we'll allow some time for questions, and I just sent a message using the chat feature. So right now I'm going to go over the questions that have already been submitted, and if anyone on the phone does have a question, just please ping me a little, either your name or something so that I can call on you and we can do it in a bit of an organized way. So just let me know on the chat feature while I answer the existing questions that have been asked. So one of the first questions was, will documentation be made available on the background and methodology used for the survey? And the answer is yes. We are writing a commentary for the special supplement that addresses the methodology, and we are in the final stages of getting that prepared and finalized. So we will share that with you as soon as it is. And JP and Vicki, please feel free to jump in if I missed something in answering some of these. The next question was, does ASTHO have information on standard classification of health departments for use when analyzing data from the survey? The answer to that is also yes. We provide, let's see, JP, you might know this better off the top of your head than I do, but we provide, I think, population, governance classification,
and region.
What else? Oh, and region. The next question was, can this data be used for publication and presentation outside of the ASTHO special supplement? And the answer to that is yes, but let's wait. So to further elaborate, if you have a fully executed data use agreement, we would of course like you to to further analyze our data and submit further projects and papers. We just ask that you kind of wait to do that. We are making this data available to the public in April, and this group is getting early access. So the first thing is let's wait to get your projects in until around April, or at least submitted until about then. And what ASTHO would also like is another proposal. So some of you have more sensitive data than others, and we would just like to make sure that what your new project deals with is still in line with our confidentiality policy. We just want to make sure that we're staying consistent with the data use agreement and policies. AP, did you have anything to add to that?
Yeah, so just to kind of reinforce Elizabeth's point, the Beaumont and ASTHO both want you guys to dig into these data and to really move the field forward. There are kind of two caveats. So the first is, as Elizabeth said, you guys have early access by virtue of being invited to participate in the supplement. And so we would ask that you wait to submit anything for publication anywhere else until the data become public. But second, and perhaps more importantly, the terms of the data use agreement that you've already had executed say that if you want to do more with it, you do need to submit another proposal for confidentiality reasons. That doesn't mean you have to sign another data use agreement or run that up the chain. Don't worry about it. That's not what we mean. It's really just so that we can keep track of how people are using the data, and that when you guys are going to submit elsewhere, we need to know that you're going to, because as the DUA says, we need to be able to check those tables and graphics or whatever just to make sure that confidentiality is protected. So as more people start to use the data, we'll see how that plays out. But for this select group, one, you guys are getting, many of you are getting more sensitive data than will be released to the public generally. But two, you're getting it early. So with those considerations, shoot Elizabeth or I an email. Tell us if you're thinking about writing something else, and we'll work with you on that. Know that we're very, very interested in people using these data as much as possible, just with the caveats I've mentioned.
Thanks, JP. So another question that I just had from Gulzar was to elaborate a little bit on the levels of participation. So Gulzar, could you tell me what exactly or could you elaborate on your question?
Yes. So you were the selection of states under your slide that was the heading was Recruitment and Fielding. So you talked about 3 levels of participation by states, and you explained it well. I was wondering if you could, elaborate a little more as to why 10 national representative sample and then increased by 3 and so forth. Just a little bit more elaboration. I didn't fully understand the rationale behind it, so
sure.
If you have something to share, that's fine. Otherwise, I can chat offline also with y'all.
Well, just briefly so that everyone knows, we basically provided these 3 options to health departments so that they could decide the survey burden that their department would have. We wanted to account for any response rate issues, so to offer them to increase their sample. And then some came back and asked us to do a census. So we really wanted to recognize the voice of our members and understand their needs. So some had just done a survey like this and just wanted to stick with the lowest number possible, which is the nationally representative number. And then others said, oh, well, let's do this instead of our own workforce survey. So they asked us to do a census.
Yeah, and two other quick things, Gulzar. So this is very much like what the National Adult Tobacco Survey does now, which is where there's the national numbers that you need, and then a state can increase its sample size if it wants more granular estimates in particular subpopulations. It's essentially the same thing. And this is what I was trying to allude to earlier. So when we set up a sampling scheme, it was really based on these 5 paired HHS regions. And from there, each state was effectively assigned a number that we needed, right? So just for all practical purposes, we can talk about it that way. And some states, as Elizabeth said, wanted to get an agency-level estimate, or some people wanted to get even more granular estimates, and that's where a lot of interest in the census involvement came from.
Makes sense. So thank you.
Great. Of course.
Okay, the next question was, will there be sample code available for SPSS? And I believe the answer is yes to that. It just requires an R plugin. So Vicki, if you wouldn't mind addressing that question a little bit more.
Yes, we are looking into that. It doesn't appear as if it's quite as easy in SPSS to implement BRR. We do have to rely on R, so we are working on pulling that together. Honestly, I think STATA and R itself and SAS are going to be the easiest vehicles. But yes, we are working on trying to pull something together so people will have some guidance if they need to use SPSS.
So the R plugin is free. We're getting the mechanics of it worked out for you all. But if
Right.
you want to investigate, I think in the guidance document we can send something else out for people who are only using SPSS. Just let us know.
Right.
But know that we're working on it.
So the next question is from Joliet Nacho, and she had a concern that her data set doesn't include some of the variables. And so that's a really great question to ask. So if you receive a data set and some of the variables are missing that are in the code book, understand that was for privacy reasons. So now usually we're working with the groups of authors to say, okay, you asked for all of the demographics. We're comfortable giving you, these 3, so pick 2 or 3. So we've had some back and forth with that. But if variables are missing, just please let us know, because it may be a mistake and we are happy to update the data set. If not, it may be because of a privacy concern. And we tried to build each person's data set based on what they requested in their proposals. So JP, I don't know if you want to add more on that, or Jelly, if you had a follow-up question.
Yeah, so know that when we prepared these data sets, there may of course be oversights, and we're happy to correct them. But if you're missing a variable, as Elizabeth said, it's probably because we didn't see it requested in your list. If you were one of the groups that requested the kind of standard public use file, which is the central office national and regional estimates, you're going to get most of the variables because we're not concerned about confidentiality there. Other folks who have more sensitive data, it's hard to know if I made a mistake or if it was how data were requested. And Julie, you can always, you can email me if I'm missing something. We'll add it back in for you.
Yeah, and this is Jali. Thank you so much for the clarification. And I'm requesting basically the local level data. So there's no variable for gender and race. I don't know, those were removed on purpose or because this just not included in the first.
Let's take that offline, and I'll work it out with you.
Okay, thank you so much.
Sure.
Yeah, for any questions related to variables or what your data set may include or exclude, please just follow up with us and let us know if there's something additionally that you may want. So I have another question from Gulzar, but we're going to wait on that, Gulzar, because we have it's a question about the local data set, which we're going to go over first.
Okay.
So let's table that for now.
That's fine.
Dr. Lee, it looks like you have questions.
Can you hear me now? I had my mute on. I have 3 things, and they're rather than process of analysis, looking at the product for publication. One of the things I think about, we're talking about a journal that's directed toward practitioners rather than academicians. And I frequently compare it in class to Harvard Business Review. I think that as a result of the audience is probably more attracted to descriptive statistics presented in the form of graphs and tables and so on. Am I misreading your intent in terms of the manuscripts you're seeking?
I think we're looking for a mix, Dr. Lee, because on the one hand, I'm sorry?
Oh, please call me Joel.
Oh, Joel. So, Joel, I think that we're looking for a mix because on the one hand, you're right that descriptives are going to be really interesting to the readership. But on the other hand, you have a pretty unique opportunity to do very kind of deep analyses with very specific subpopulations if you're interested in doing that. And so it might be the case that more advanced inferential statistics are appropriate. And certainly that's something we're seeing really kind of interesting and meaningful findings, meaningful to practitioners, are coming out of some of the regressions that we're doing for some of the work that we're looking at as part of the supplement too. So know that both are welcomed. It's really about what question you're trying to answer.
Okay, great. That helps. The other thing in regard to the manuscripts that I was thinking about, with this introductory discussion of the survey and methodology, I know it's not your intent to have each of the manuscripts that follows that presentation to repeat the same information. Do you have any advice in regard to where we draw the line between the introduction and the individual manuscripts? To be honest, it might be useful even to see that early in the process to build the successive manuscripts around that first one.
We agree entirely, and that's our plan. So we're finishing up that methodology paper as we speak. It's actually going to go into clearance shortly. And so well before you all will need to turn in your articles to Dr. Novick at the journal, you'll have access to it in case you want to cite particular things. I think we might actually encourage it for the reasons you outlined. Certainly for some of the other papers we're doing, we have very abbreviated methodology sections and are citing this report for a full description. But really, what we're sort of doing is any of the development and the fielding, the sampling, that's very abbreviated in what we've written so far. And then where our methods are a bit longer are the particular analyses that we're doing for that manuscript. So if it's, more advanced inferentials or just basic descriptives, that's sort of where the meat of our methods papers are looking right now. And I wouldn't be surprised if that's how it works out for others too.
Oh, great. Thank you. And then my final one, Elizabeth, you and I have been talking for weeks in regard to finalizing the institutional agreement. We finally received access to the data. Are you still holding to the original timeline?
Yes, to answer your question, I believe we are. It's the deadline is from JPH&P. It's not something I don't believe that we have flexibility to change.
It's not.
Okay,
so,
great.
Yeah, just so everybody on the call knows, the deadline of next month is really due to JPH&P's publishing schedule. If for any reason you feel like there's going to be a hiccup in you trying to meet that, please let us know as soon as possible so we can talk to you about alternatives potentially.
That's it. Thank you very much.
The only other question that I had was from Jennifer Williams, and I think, Jennifer, did you get my chat back to you?
Yes, I did.
Okay, great. We will get you a new data file as soon as humanly possible.
Okay, no, that's fine. We actually we had a conversation yesterday with our team, and we just thought we were missing something in our analysis. So we just wanted to confirm we weren't losing our minds as well.
No, not at all.
All right, thank you.
No problem. Okay.
Actually, can I jump in with one other thing?
Sure.
It just occurred to me, based on your emails, we know who the participants are. It would be really interesting to see a list of the topics that you've selected.
Sure. I think I could put together maybe a list of the titles if no one else minds. you can kind of get a feel for at least the topics that are going to be covered.
That would be great.
Yeah, let me amend that slightly and just say if anybody is uncomfortable with us doing that, please send us an email. Otherwise, we're going to send out the topics, just so everybody knows. We won't necessarily send out all the authors, et cetera. That's all your business, of course. But just so everybody knows, if any objections, let us know.
Yeah, and you can just shoot me. I won't send anything out for 24 hours. Just please shoot me an email if you want your topics to be excluded. So I'm going to pause for a second. We're running right on time, but I want to make sure there aren't any last-minute questions. I don't have anything new in my chat box. Is there anything else before we move on to the local data discussion? I would, anyone who is not interested in our local data file can go ahead and hop off. So I just want to give a couple minutes to transition here. Okay, great. So with that, we'll go ahead and go into the local data discussion. So really, this local data set was really meant to be a pilot project for future generations or for future iterations of PHWINs. We were testing, and to do that, we were testing varying sampling and survey distribution methods from state to state. So while the survey instrument was identical to the one used for the state health agencies, and there were similar recruitment efforts, the local data set was really never meant to be widely distributed. So we will not be sharing this data with authors unless we have already had discussions with you or your analysis is dependent on the local data. So please, if you are planning on using the local data and you haven't spoken to us already, please let me know so we can have a conversation about that. JP, is there anything you want to add?
I don't think so right now. I'll talk about it I guess maybe I will because it's the next slide, right?
Yeah.
Okay, so, oh wait, no, this is Vicki's slide. Never mind. No, come back to me in a minute. Vicki, it's all yours.
Okay. Well, I think this will be pretty quick because the methodology is very similar in terms of estimation and variance calculation for the local office sample as for the regional sample I talked about earlier. Basically, we have some sample that combined across the multiple frames that we had to start with, both the state level list of central office employees. It also included some local office employees, and then we have the actual local office staff lists or local health departments participating, and then we had the big cities. So there were these three component populations that we were able to determine certain states had sufficient sample across those components if we combine them to support state level estimations for local employees. So the states are listed in the slide, the 15 states where there was enough sample to calculate a weight and to support some state level estimation for local employees, permanent employees. So the weight for these 15, across these 15 states is called local_weight, WT, and each respondent is classified as a local office employee if they reported their permanent employee status and local office status. And they have all of these have a positive value for the variable local weight. And as I said, they may have come from the quote-unquote national frame or the local frame or from the big city frame. And these weights are appropriate to estimate for the local office permanent public health employees that are representative of the combined 15 states, as well as estimating survey outcomes for each of the individual 15 states or any sort of roll-up of any of the 15 states. But they're not to be used for national level estimation. We wouldn't want to say, based on these 15 states' weighted estimates, that we're reflecting what's going on across the U.S. At the local level. And then similarly, the standard errors are calculated using replicate weights through the BRR approach. Instead of having 40 sets of replicate weights as we did with the regional estimation, we actually have 28 sets of replicate weights. So in the examples that I presented earlier where you had replicate weights going 1 to 40, you basically have replicate weights going 1 to 28 and named local underscore rep weight. So very, very similar approach for this subsample of all the local sample that was obtained in PHWinds.
Okay. Good. So I'm happy to talk about strengths and limitations if we can go to the next slide. Okay, so first the limitations for the central office or state health employee frame, which we talked about earlier. So general limitations, of course, it's one-time, cross-sectional, but it's important to note that there's good representation from the regions, the different sizes that are served by the state health agencies, population sizes, governance classifications. So really we have a good representative number. It could always be better if we had more state health agencies participate. Non-response is always an issue. There might be something about these 13 that makes them different with respect to, for instance, job satisfaction or other outcomes of interest. We don't have any evidence that that's the case, but of course it's worth mentioning. A couple strengths of the state data set. So one, we're using the best type of variance estimator we can. There are certain constraints with Taylor series linearization or alternative that would have made certain nonlinear estimators, I think the variances would have been off a little bit. So our weights are good. Implementation is actually relatively easy unless you're in SPSS, but you can still do it. The big thing, though, is that we've got 10,000 responses, which is great. It's a huge proportion of the population of interest, but we think probably over a quarter, or right around a quarter, I should say, which is remarkable, right? So the first time it's been done, nationally representative, tons of responses, so you can do very detailed analyses, very robust regressions. It'll be great. Next slide. When we think about the local health department data set, things are a bit different. As Elizabeth mentioned, it's always been intended as a pilot. It just sort of happened that we have a massive convenience sample of about 13,000 local responses. So we want researchers to be able to use it. When all of this was started, we weren't necessarily thinking about releasing it. And we're still not going to release it widely because there are a lot of those considerations that we talked about. But a few of you have very specific questions that can only be answered with these local data, and we want to make sure that as you start to do your research, you fully understand the constraints under which you're operating. So the first is that fielding different state by state, as Elizabeth mentioned, and it's all detailed so you can look at it for each state. The vast majority of respondents are going to actually come from folks who participated in the state frame where the state health agency was not able to distinguish between a central office versus non-central office employee. Now in centralized states, that's fine, right, because that means your local health department employee, all of them essentially have an equal chance of being selected. But as you think about decentralized or mixed states, that's more difficult because you might be a state health agency employee in a local health department with other employees that are not employed by the state. And so there's not equal probability of selection. And for that reason and others, we really caution you about trying to extrapolate in states where we haven't given you a weight in those 15 states. Those 15 states, we think the local health department employees had an equal probability of selection under the sampling frames that we outlined. Those differ state by state, mind you, but still, we think they're reasonably okay. For the other states, we don't think that's the case, and so we didn't assign them weights. So as you think about looking at unweighted or unbalanced estimates, that's a really big consideration. You're going to see a lack of good representation from decentralized employees in many cases, especially. So again, as you think about limitations, you can do state-based estimates. You can't really do regional estimates. You can't really do national estimates. We'd really advise against thinking about them that way. They can really only be boiled up to the state level, whereas Vicki said if you want to look within the 15 states or so where we think the estimates are weightable, you could do that. There is a second set of weights that we're not releasing widely at all. that allow for comparisons between state health agency employees at the central office versus local health department level. Those weights are even more restrictive because they really only are applicable or usable in a few instances for the type of research that you all might be doing. If you have questions about that, please email us. We can set up a time to talk with you. But again, they're probably not going to be useful for your purposes. So I think that I will highlight again, no national estimates. You can get state-based estimates for those 15 states. But I know it's going to be pretty tempting to do some kind of unweighted analyses with these 13,000 local health department employee responses. And I'm not going to stop you, of course, but just please use caution as you do it.
So thanks, JP. Let's open it up again with questions. I don't have anything right now in my chat box, but does anyone have a question about the local data? We have time, and we can extend a little bit past noon if there are any burning questions. Jolly, do you want to go ahead and ask that question?
Sure.
Posted?
Sure. I'm looking at the code book. There's a variable setting, and obviously that's a newly generated variable based on a question in the survey. And so in what's coded as 2 as other LHD and RHD, it's coded based on Q527 if it's equal to 1, 2, 3, 4, 6, 8. And also in addition to that, if they have a file equal local palette, they're also recoded as other LHD. So I can find Q527, but I can't find the variable file. Is this something that you generated out of this data set?
Oh, yes. So that's an oversight on our part, Julie. That variable in question was an internal one that we used in the sampling frame. We could provide it to you if you need it for any reason, but it's probably not helpful other than maybe for this, if you need to double check something. But yeah, so we can talk more about that if you need to, but yeah, we do have that variable, it's just not in your particular data set. If you need it, we can talk to you about it. That's no problem.
Oh. No, I don't think I really need it. I just want to, make sure I understand what that means. And I suppose even if without the file variable and just based on Q527, I still get the similar recoded variable. Is that right? Yeah.
So you in your data set, I hope, have a setting variable. If you don't, then I need to. Oh, well, then I need to add that to it. I am sorry. Let me add that to my list. So that's my fault. So I'll add that to your file, and we'll get it uploaded to you right away.
Okay, thank you.
Yep, and others too. We've put together many different requests, and so if you're missing a variable that you requested, please tell us. It may well be that I forgot to include it in your data set, and if so, I'm sorry.
Are there any other? Yeah. Okay. Well, with that, I think we can go ahead and go. Good luck to those who are still working with getting their data use agreement signed. I'm sure we will get this cleared up soon. If you have any questions once you receive your data, or if during the analysis you have any further questions, please feel free to contact me. You all have my email address, and I will make sure that it gets to the right person if I can't answer it. So thank you so much to all for being on the phone, and we look forward to reading your papers.
Thank you.
Thank you.
Thank you. Thanks. Bye-bye, everyone.
Bye.
Bye.